This program is all about epilepsy and how to recognise and manage seizures. You might have epilepsy yourself or know someone who has it, or you might be completely new to it. We hope to answer some of the questions you might have about epilepsy and show how you can help someone who is having a seizure. For clarity, all the seizures you'll see in the video are performed by actors. I will describe what is happening to the person and what a bystander can do to help and keep them safe from harm. You will find that helping someone during a seizure is easy and you don't need any special training.
Sorry, can you repeat that?
It's a neurological condition, which means it affects the brain and nervous system. Someone who has repeated seizures has epilepsy, and it's common. Around 1 in every 100 people in the UK has epilepsy. That's over 500,000 people. Anyone can develop epilepsy. It happens in all races and social classes, and it can start at any age, although it's more commonly diagnosed in children and in people over 65. There are many causes, such as head injury, an infection such as meningitis, a scar or a tumour. Sometimes it's a result of a genetic condition or a change in genes before birth. Sometimes the cause can't be identified, but it's not something you can catch from another person. Diagnosis can be difficult. Unless someone is having a seizure, there might be no obvious signs that they have epilepsy. To try and identify a cause, a neurologist will normally arrange for an EEG, electroencephalogram, which looks at brain activity, or an MRI, magnetic resonance imaging scan, that takes pictures of the brain. The person's medical history will be looked at, and they'll be asked about what happens during a seizure. Many people will have no memory of a seizure, so it's helpful to ask someone else who has seen a seizure what happens during the event. There are lots of different names used for seizures, such as fits or funny turns, but all epileptic seizures start in the brain. Our brains have millions of nerve cells called neurons, which control everything we do, from how we think to how we move and feel. Our brains work by sending and receiving electrical messages between nerve cells and our body. During an epileptic seizure, the way the brain normally sends electrical messages gets temporarily disrupted. This disruption affects how the brain works, which causes a seizure. We can think of this as a bit like when you're trying to do too many things on a computer and the computer stops working for a short time. Once it reboots, the computer starts working normally again. So what triggers a seizure? Seizures can happen anywhere, and they often happen without warning. For some people, certain situations can bring on or trigger a seizure. Common triggers include stress, lack of sleep, and forgetting medication. Some people have seizures triggered by flashing lights or moving patterns and shapes. This is called photosensitive epilepsy. Photosensitive epilepsy is not common, and only about 1 in 20 people with epilepsy are affected by flashing lights. The aim of treatment for epilepsy is to control seizures and stop them from happening. Most people with epilepsy take medication called anti-epileptic drugs for their epilepsy. These drugs stop seizures happening by reducing the excessive electrical activity in the brain that causes the seizures. The drugs don't cure epilepsy and are not usually used during a seizure to stop it. Although anti-epileptic drugs will control seizures for many people with epilepsy, there are other types of treatment that might be tried if medication doesn't work. This includes brain surgery to remove the part of the brain that is causing seizures, or using a small implanted device that aims to regulate the brain's electrical activity to stop or reduce seizures. For some people, their seizures will stop happening of their own accord. For others, their epilepsy might be lifelong. There are lots of different types of seizures. Some seizures can be quite subtle and hard to see, and others might be more obvious. Not everyone will lose consciousness during a seizure, and some seizures include unusual behaviour. Some people may have more than one type of seizure. Some seizures affect only one part of one side of the brain and can cause unusual sensations or behaviour. Some seizures affect both sides of the brain from the start, and the person will become unconscious. These can be quite subtle, absent seizures, or more obvious convulsive seizures. Seizures are often classified into different groups depending on what happens to the person during the seizure. This depends on which part of the brain the seizure affects and what this part of the brain normally does. Once a seizure starts, you can't stop it. It will usually last a short time, seconds or minutes, and will stop of its own accord. Although seizures can be frightening to watch, they are not usually painful, and the person usually recovers fully afterwards. If you know someone who has seizures, you could ask them about what they would like you to do to help them if they have a seizure. We're now going to see demonstrations of different types of seizure. In simple focal seizures, just a small part of the brain is affected by the seizure. Often the person will have a strange sensation, such as a strange taste in their mouth, a funny rising feeling in their stomach, a sudden feeling of fear, déjà vu, feeling like you have experienced something before, stiffness, twitching, or an odd sensation in part of the body. The person themselves might feel upset or disorientated by what is happening. These seizures can sometimes lead on to other types of seizure, and then they may be called seizure warnings or auras. In this film, we see what someone having a seizure in the part of their brain that controls vision might experience. We can see that their vision is getting blurry, starting at the right-hand side of the screen, and they start to see coloured lights moving around and changing colour. The coloured lights start to take up all of their vision and get brighter, before gradually disappearing. The person will be aware of what is happening, although people around them may not know that they are having a seizure. There is nothing you need to do when someone has a simple focal seizure, other than reassure them if they are upset or disorientated. With complex focal seizures, a larger part of the brain is affected than in a simple focal seizure. Typically, the person will not be fully aware of what is happening and may be confused. They may not remember the seizure afterwards. During these seizures, the person may make strange or repeated movements, such as lip smacking or chewing movements with their mouth, or they might fiddle with clothing or objects on a table, make mumbling noises, or perhaps strange postures with their arms or legs. Typically, the person won't be aware of what they're doing and won't be able to respond to you if you talk to them. Complex focal seizures can last from a few seconds to a few minutes, although it might take the person a little longer to return to feeling normal. Here we see Tom playing football with some friends. He suddenly stops running and stands still. We can see him fiddling with his top with one hand, while the other hand is clenched in a fist and raised up. He is making chewing movements with his mouth and is not fully aware of his surroundings. His friend comes over and gently guides him off the pitch. He is speaking quietly and calmly to him so that he is not startled.
Is everything all right?
He makes sure that Tom is not likely to walk into any dangerous situations.
He's having a seizure.
Can you hear me?
As he starts to come around, he is still a little confused. Tom won't really remember what happened during the seizure. This is when the person's body suddenly goes stiff, and they usually fall down if they are standing. Often they will fall backwards and might injure the back of their head or body. Although the person briefly loses consciousness, this type of seizure is normally very short and they will usually recover quickly. Here we see Aisha standing in a queue for a bus. She suddenly goes stiff and falls backwards. As soon as she falls to the ground, she starts to recover.
You're right.
We can see that her friend reassures her and checks that she has not hurt herself.
Sure you're okay?
Yeah, I'm fine.
She's able to go back to what she was doing almost immediately, although she may feel tired afterwards. In an atonic seizure, the person's body suddenly goes floppy. If they're standing up, they will usually fall. Because they are likely to fall forwards, they might injure the front of their head and face. Sometimes these are called drop attacks.
We could actually bring it forward a little bit more. I don't
Although the person briefly loses consciousness, this type of seizure is usually very short and they usually recover quickly. Here we see Ravi at work.
I've got his file somewhere. Yeah, okay. Ravi, could you do us a favour? Could you pass me that file?
Sure, yeah.
Yes, that would be great. Thank you. Thanks. I'll find out what day.
He suddenly goes limp and falls
How
forward.
about Tuesday? I'm going to call you back. Hang on.
Almost immediately he starts to come round and recover.
You alright?
I'm okay, thanks.
Okay. Can I get you anything?
We can see that his colleague checks that he is not hurt and that he is able to go back to what he was doing.
Get that client back on the phone then.
During an absence, the person is absent, goes blank and unresponsive for a couple of seconds. Absences are very brief and can go unnoticed, but can happen many times a day and so can be very disruptive for the person. The person won't be aware of the absence as they are briefly unconscious, but they might notice that they have missed bits of a conversation, for example.
So, as regards to this course you're choosing to take, what's your thoughts?
Absences tend to be more common in children and young people than in adults. Here we see Jo during a conversation at college.
Well, I think the fact is it's a good idea, but is it your passion? Because remember, you've got to spend the next couple of years...
She looks blank and stares, and then comes to. She is briefly confused as she has missed what the lecturer was saying.
Sorry, can you repeat that?
Well, what I was about to say was...
If she was outside, a friend might just make sure she is safe and guide her away from any danger. Some people have atypical absences, which tend to be longer than typical absences and often include some physical movement, for example of the head or body. Myoclonic means muscle jerk. In these seizures, the person has brief jerking of a muscle. This might be an arm or leg or the body. It might affect one side of the body or both sides. These jerks are a bit like the jerks we all sometimes get when we are falling asleep. But myoclonic seizures tend to happen at other times of the day, often first thing in the morning when waking up. These jerks also often happen in clusters, when many happen close together in time. Here we see Sarah have a brief jerk of her arm while she is putting on her makeup. This is clearly frustrating for her, but there is nothing that needs to be done during these seizures other than making sure that the person hasn't hurt themselves. This is when the person stiffens and then shakes. It is the seizure most people think about when they think of epilepsy. During this seizure, the person will be unconscious. At the start of the seizure, the person's body suddenly goes stiff. They might cry out or bite their tongue, and you might notice some blood or saliva around their mouth. They will fall down if they are standing. Their body then rhythmically jerks or convulses for a couple of minutes before gradually stopping. Here we see Tom in the kitchen preparing breakfast. He suddenly falls down. His body begins to shake as the muscles relax and tighten in turn. During this time, his breathing becomes quite noisy and laboured, and he might start to go pale or blue around his mouth. His friend puts a towel under his head to protect it. She might move the table or chairs if he is likely to hurt himself. The jerking lasts for a couple of minutes and then he becomes limp and starts to come around. His friend gently turns him onto his side into the recovery position to rest. He will probably feel very confused, tired and achy, and might want to sleep for a while. His friend will keep an eye on him to make sure he recovers properly. During a convulsive tonic-clonic seizure, try to stay calm. Check the time to see how long the seizure goes on for. Put something soft under their head to protect it, or cup their head in your hands. If they have tight clothing around their neck or they are wearing a headscarf or veil, you might want to loosen this to help them breathe. If they are outside, try to stop people crowding around. Allow the seizure to happen. Don't restrain them or hold them down. Don't move them unless they are in direct danger. Move objects away if they might hurt themselves. And importantly, don't put anything in their mouth. They will not swallow their tongue. After the seizure stops and they stop shaking, roll them onto their side into the recovery position. Try to minimize any embarrassment. If they have wet themselves, try to deal with this sensitively. For example, you could put a coat over them. If their breathing sounds difficult or noisy, check that nothing is blocking their airway. You might also wipe away any spit from around their mouth. Stay with them until they have fully recovered. Secondarily generalized seizures happen when a simple or complex focal seizure spreads so that the seizure affects both sides of the brain. The person loses consciousness and will usually have a tonic-clonic seizure. Occasionally, it may be necessary to seek help when someone is having a seizure, and so here are some suggestions. Seizures tend to be short-lived and end of their own accord. Normally, people do not need medical treatment after a seizure and do not need to go to hospital. However, it is important to call 999 for an ambulance in the following situations. If it is their first seizure, they have injured themselves, they have trouble breathing after the seizure, one seizure immediately follows another with no recovery in between, the seizure lasts 2 minutes longer than is usual for them, or the seizure doesn't stop after 5 minutes. Kneel on the floor to one side of the person. Place the person's arm that is nearest to you at a right angle to their body, so it is bent at the elbow with the hand pointing upwards. This will keep it out of the way when you roll them over. Gently pick up the other hand with your palm against theirs, palm to palm. Now place the back of their hand onto their opposite cheek, for example against their left cheek if it is their right hand. Now use your other arm to reach across to the person's knee that is furthest from you. Pull their knee up so that their leg is bent and their foot is flat on the floor. Gently pull their knee towards you so they roll over onto their side, facing you. Their body weight should help them to roll over quite easily. Move the bent leg that is nearest to you in front of their body so that it is resting on the floor. Bend their knee so that it is at a right angle to their body. This position will help to balance them. Gently raise their chin to tilt their head back slightly, as this will open up the airway and help them to breathe. Check that there is nothing blocking their airway. If there is an obstruction such as food in their mouth, remove this if you can do so safely. Stay with them, giving reassurance until they have fully recovered. I hope we have helped you to understand more about epilepsy. If you would like to know more, you can contact Epilepsy Society. Thank you for watching. Goodbye.